ultimate men's movement with our host, Dr. Jack Rocco. Dr. Jack, we have a very interesting subject matter today to talk about, especially when people are dealing with erectile dysfunction.
Yeah, I like the idea that we have so many different ways to address the problem. With ED, people, you classically think about the pills, and the idea of the pills is that it stimulates the blood vessels to increase, of the penis before the erection. There's other ways that are, what I would consider more quote unquote natural. They're non-pharmacologic ways to do this. And this brings us into the regenerative medicine realm. And this is something that I really like. This is, the regenerative medicine realm kind of was what inspired a lot of me to get into the cosmetic surgery field. And it started off with PRP. And I'm not sure, if you follow along with some of the, the sports, but PRP is basically where you take the patient's own blood and you use that to help revitalize the area. Okay. And, so you draw blood, you spin it down, and you remove the red blood cells from it. So that leaves you with the plasma. And that is the healing element that really, the oxygen is delivered with the red blood cells, but the white blood cells, all the factors that go into healing, platelets, that's why it's called platelet-rich plasma. And platelets are good for blood coagulation, but also just for, primary healing. And a lot of what we do with surgery, I was very reluctant to get onto the PRP bandwagon. It seemed to be redundant for me because they were using it when we first started. We were using it during surgery. While you're doing an open surgery, you're opening the limb, you're doing the surgery, and then there were some guys that were squirting PRP into the area. And that, to me, in my mind, just seemed like an unnecessary redundancy because you're already creating a bleeding environment that's going to bleed. So why do you need to put more blood in there? And it kind of fell from favor. Insurance companies weren't covering it, and it was an added expense without any reimbursement. So it kind of fell out of favor during surgery. Some people are still experimenting with it, but not as much. But the idea of doing it instead of surgery is very appealing to me because basically you're putting in the healing elements without the incision, without the surgery. And like I said, a lot of what we do with surgery, you have a tendon that's torn, you go in, you sew it together, but it's the influx of all the healing elements, the plasma, the platelets, the healing factors that actually do the healing. Surgery doesn't technically do the healing. It creates the environment for healing to occur. You have to work, whether it's you and the Lord or you and Mother Nature, the surgeon doesn't really do any true healing. It's the blood process that does the healing. So I went to a course on PRP, which was, it started off as something that can be done, for non-surgical treatment of orthopedic conditions, such as knee arthritis, shoulder rotator cuff. There are guys that are experimenting with taking this PRP and injecting it into a degenerative knee as a way to rehabilitate and enhance the knee arthritis. And
Right.
I personally, I had my right knee, I had my ACL reconstruction, I had a second procedure for stiffness, and then I had a third procedure for meniscal repair. And during COVID, it was really bugging me. So I've given myself PRP injections, and it works great. It works a lot better than cortisone. Cortisone actually shuts down the healing element, which gives you a decrease in the inflammation, but then there's often a rebound or you get used to it. Whereas the PRP, it actually provides some of the healing elements, and I've been very pleased with my injection. But other ways to use the PRP, there is a physician in Alabama named Charles Runnels. And Charles Runnels, he's the guy who invented the vampire facial.
Okay.
And, they said this is kind of like meeting him and learning about his PRP treatment got me interested in the cosmetic aspect of things. And, it's interesting because he had an incident with Kim Kardashian. Like, she on her show talked about that she had the vampire facial. And, then, so now that kind of really brought his product, he's got a patent and the rights to that procedure. And when Kim Kardashian mentioned him on her show, the popularity of his procedure went through the roof.
Right.
So he does it for the skin, and it does help with the skin. What it does is, as you put that, you use some micro needling device, and you paint the face with the PRP, and then use the micro needling to drive that PRP into the lower dermal area of the skin. And once you do that, then it forms the collagen, and that's the key. The key is the collagen that comes to healing. So all these healing elements, the platelets, and the plasma eventually will become collagen. And, the thickness of your collagen in your skin is very important for wrinkles. Clearly I probably need some of it, but, that's the benefit of it. So he started experimenting with the vampire facial, and then he also did what he called the P shot, was a way to revitalize his own. He started off experimenting on himself with a lot of these things. And it was in purpose of helping him with his erection. And it worked, so by spinning down, like the same thing, it has this revitalization process, revitalization method for, non-surgically just renewing the tissue, or for lack of a better term. And the corpus cavernosus, that's the area of the structure in the penis responsible for the erection. By putting the P shot within the corpus cavernosus, it helps to stimulate those to respond better, prior to sexual experience. And there's the P shot, and this is another one that women love, is the O shot. And the O shot, the O stands for basically orgasm shot, which helps females with lubrication, with stimulation, with responsiveness during sex as well. And it also had an interesting side effect of helping with urinary incontinence. And that's a special, this is one of the most amazing things about it that I learned, that it was really very helpful for a lot of women, is that the urethra in a male, the urethra comes out of the end of the penis. That's your P tube, so the urethra comes out, and it's normally, it's got a round muscle that opens and closes it. Okay. In females, the clitoris is the same thing as the penis. That's the analog. But the urethra actually migrates down below. And as it migrates below, this area underneath, the muscle sphincter is more of a horseshoe shape because it's been dragged down. So when women have female incontinence, it's because this part here, the part of the U, gets stretched out. So they try and close it to cut off the urine, and they can't. The muscle, instead of being circular, and it closes, and I'm not sure if my talking with my hands is good audio visual, but you get the idea. So if this part is stretched out from childbirth, from aging, from sports, various things, now when this tries to contract, it doesn't cut off the urine, and then you get that drip, that post-urinary drip. Incontinence. With the O shot, what you do is the injection goes right into this area, and that area is where all the glands are that provide lubrication for the female, and also a heightened arousal in that area. So it revitalizes those glands in that area, but it also provides some collagen at the top of this U. So at the top of this horseshoe, now it's given an increased bulk of collagen in this area So when the urethra, when it closes, it helps with a lot of more of the urinary, control of the urine and the prevention of the incontinence. So, the PRP, it's being used in so many different ways. The face, the penis, the urethra, female sexual. And it's something that I think, along with peptides, it seems like, we're getting away from big pharma, big surgeries, and going towards more natural ways.
Yeah.
And what a more natural way to provide healing and rejuvenation than with your own blood. There's no risk. And that's some of the reason why it hasn't become as popular, because it's difficult to profit off it. You can't profit off, someone else's blood. You can profit a little more off a pharmaceutical to give. So, I'm really, as I've gotten older and matured in my career, I try to avoid surgery more. I try to, discuss health, nutrition, PRP. I think, these are all what I would consider natural ways, that there's the side effects are few. It's your own blood. There's no risk of transmission. It's just, whatever the expense is. And another thing along those same that we've been dealing with this week is we have this device that's called a P wave. And the P wave, PZO wave, it's a way to deliver ultrasonic shock waves deeper into the body. And you can adjust the depth of field of where those waves, and it provides a little makes this noise, and you feel it while you're operating the machine. It's just creating shock waves. And similar to how they've used shock waves for lithotripsy, for breaking open stones, the same calcium and the coronary artery disease or arterial sclerosis is caused by that similar calcium plaque. So one of the other sources of or causes of erectile dysfunction is poor circulation from arteriosclerosis. If you have a normal erection in the morning when you waken, that is a good sign of your heart health. And there's different ways to do it. But with this PZO wave, you can use it for calcific tendinitis, like golfer's elbow. And these are things that we can all do in the office. Like me as an orthopedic surgeon, plantar fasciitis is something that we can treat. I said lateral epicondylitis, tennis elbow, golfer's elbow, patellar tendinitis, various things. But we're also using it in the penis to help improve blood flow by breaking up those calcific deposits within the artery of the penis. It breaks it down and improves circulation, improves erection. And we have different packages. If you want to do 6 treatments, if you want to do 12 treatments, so it's something that is done over time. Usually we do, like I said, if we're doing, we try to do maybe, if we do it 3 times a week we have a patient now that I did today. He's on a 12 treatment program. So we're going to do 3 treatments a week for 4 weeks, so that'll bring him over the next month, with those shock waves. It's just repeated. It takes about 20 minutes or so to do the procedure by the time you go through it. But it's once again, a great way to improve your function, improve your life, not your lifespan, but your health span. And we've talked about this a number of times, that it's not just your lifespan, it's your health span. How long do you want to be healthy? You could live to 80, and do you want to be 60 looking like 40 or 40 looking like 60? And, it's our goal really to improve your function, and for men, sexual function is a huge of that, maintaining your productivity with health, with life, with work, with your relationships. This is when it gets hard for men, 50s, right, 60s, you're struggling, you're producing, and you want to keep going. So the idea is to keep you going, to keep you healthy with the testosterone, with the erections, with some of the procedures that we're dealing with, but also all those musculoskeletal things
Totally.
that we deal with. So, it just, we've taken our time and done a lot of introduction, and we've been doing this now 4 or 5 months on our podcast, and we're really getting a broad library of all the various things that we do.
Totally.
We do the testosterone. We can help with diet. We can help with, erections. We can help with orthopedic conditions. So it's just been a great opportunity to introduce, a lot of the concepts, as well as the various machines, the various products we have that are all helpful for that purpose of keeping you young into your older age.
Well, that's what you're doing, and you're also making it enjoyable that time older, so that you don't remember, well, I can't go explore the country, or I can't go do this anymore. You feel like you can't, or you feel like you could go and we're seeing this in certain men, right? In the professional wrestling or the boxing or sports that in their 50s are starting to perform as well as some of the younger guys.
Well, look at the NFL. You got, Flacco and Rodgers.
Yeah.
You got 2 quarterbacks that are doing great.
Exactly.
Reasonably well.
Yeah, reasonably, I guess.
Yeah,
we don't talk about the Steelers last night. No.
Yeah. You got Steelers and, but no, I mean, I don't know what those guys are on, but I wouldn't be surprised. I don't think testosterone has ever been shown to be, performance enhancing. It's more of, like if you've got a thyroid issue.
Oh, so that's interesting. So that's a little different testosterone than human growth hormone. Totally different.
Yeah, it's, I think they're really splitting hairs, but there's a guy up in Boston, his name is Morgenthaler, and he's been asked to give an opinion on some golfers that are on testosterone. And, is that a medical treatment, or is that a performance?
That's interesting.
Enhancing, and I think a lot of the results, or I'd have to, I'm not an attorney. I'm not here to give you legal advice. But, like I said, if you've got a thyroid, his argument for this was, if you have a thyroid deficiency, the thyroid is a hormone.
Right.
Insulin, if you're diabetic, insulin is a hormone. So you take your insulin for your diabetes, or your thyroid medicine, your thyroxine for your thyroid. Is that a performance enhancing, or is that a needed medicine? And the argument is that it's a needed medicine, and the idea of testosterone and estrogen fall into the same category. I mean, these are things that really do enhance your performance, and we're not worried about it because, we're not athletes, but sometimes it does get into the realm of athletes using, is that enhancement, or is that a required medical treatment? And more, I remember when Viagra first came out, erectile dysfunction wasn't a disease.
No.
You just had a limp one, and, you weren't getting it up because you were getting older, and then they came out with the whole word ED, erectile dysfunction, was a product of the pharmaceutical that was now available to treat it. So it was almost like the production, it wasn't a disease. You just
exactly.
But it was like the production of the cure actually created the disease, if you think about it, because before it was just a thing. Now ED is a disease, so it kind of goes against the Hippocratic Oath in a little ways, first do no harm. But you're kind of creating a diagnosis because you now have a treatment for it. But, the treatment didn't just stop at Viagra. It's gone on to, like we've talked about, we've talked about the enhancement. We've talked about the pills. We've talked about the P shot. We've talked about the PZO wave. So there are many different ways to treat this issue that are non-pharmacologic, that are more natural, that are, there's all sorts of, just keeping your health is the most important. Staying healthy. If if you're healthy and horny, you're healthy. I've heard someone say that, and it's if you still have a sex drive into your 40s, 50s, that's a healthy thing. That shouldn't be something that you are embarrassed by or you try to shun away. I don't know who said it, but someone said, like, if you're in your 40s, if you're horny, you're healthy. So I think it should be, if that can
you should have a bumper sticker.
Well, we could do that.
You should create that bumper sticker.
The ultimate men's movement, the ultimate men's clinic. If you're horny, you're healthy. Let's work on that, Neil.
I like that one. See, that just shows your ideation. Appreciate it, sir. You go to the ultimatemensclinic.com. It's in New Bedford, Massachusetts, but he also provides consultations throughout the country. Go check it out. Appreciate it, Dr. Jack. That was the special simulcast of the Neil Haley Show and the Ultimate Men's Movement, guys. Take care.